Hi everyone, my name is Laura Fry and I'm going to be talking to you about sex after a fourth degree tear. But before I get into that, I just wanted to say a huge thank you to Ashley for having me on your channel and for trusting me for talking about this very important topic, one that's very sensitive.
Welcome to my channel, or welcome back. I'm going to be interviewing Laura Fry, who created something called Mothers with Fourth Degree Tears. In 2012, Laura endured a fourth degree tear and sought out support on Facebook.
I had just been looking around for some sort of support group. I had found VBAC support groups, cesarean support groups, birth trauma in general. About 2 years after that, I created a Facebook support group for other people who had also had a fourth degree tear. It's been exactly 5 years ago since I did that.
After starting her support group, Laura realized that individuals weren't even sharing their struggles with people close to them. This includes their partners and even doctors.
I just realized that women were suffering emotionally, physically, and they weren't talking about it. I reached out to someone at Scary Mommy who wrote an article for us. I also created our own website, our Instagram account, our Facebook page, our podcast. I just wanted to get information out about us because people don't typically talk about it in person. A fourth degree tear is the worst tear that you can get from a vaginal delivery. So there are 4 degrees, first being the least severe and fourth being the most severe. And what that means is that you have torn all the way from your vagina through the perineum, the area between the vagina and the rectum. You have torn through both your internal and external anal sphincter muscles, and you have torn into the rectum itself. So you are completely open from your vagina to your rectum. And so if you think about the repair that is required, that's a pretty extensive repair. Someone could be diagnosed with a second degree tear or a third degree tear and then later found out to have a fourth degree.
Fourth degree tear can occasionally go misdiagnosed or undiagnosed.
Based on what research we do have, third and fourth degree tears make up about 3 to 5% of vaginal births.
Third and fourth degree tears are more common for those giving birth vaginally for the first time by 7 to 10%.
Just fourth degree tears by themselves, from the research I've seen, it somewhere around the 1%. I wanted to bring up another type of tear that we classify as a fourth degree tear, and for our support group we do have women in them who have this specific type of tear, but it's something called a buttonhole tear. That is when externally, so when you're looking at the perineum and where you're classifying, the first degree, second degree, third degree, fourth degree, sometimes that can be maybe only a second degree. But internally, deeper into the vagina, there can be a tear that goes all the way down through to the rectum. So it's an internal tear that's not as easily diagnosed. And so if those do get missed immediately at delivery and not repaired right away, then they can turn into something called erectovaginal fistula, which is basically just a tunnel between the vagina and the rectum. If you have that tunnel there that does not heal all the way, then you can have like gas or stool leak through from the rectum to the vagina. And those are also possibilities even for a fourth degree tear if for some reason it does not heal completely. It's very wide ranging. There are some women who heal really well. It only takes a few weeks, maybe by the time they make it to their 6-week checkup with their OB or their midwife, then they feel pretty good and pretty back to normal. That is kind of on the extreme range. On the opposite side of that extreme would be someone who they're never going to fully heal, who is going to have to live with something like fecal incontinence for the rest of their life, or they are going to have something like a colostomy bag because of that. And so those are kind of the extremes, and then you have everything in between.
Laura shared with me, on average, healing can take around 3 to 6 months. However, it varies from person to person.
There's a phrase that a lot of us have been told that I know for some women, especially anyone who has had a C-section, this can be kind of triggering, so warn you ahead of time. We've been told by either our doctors or our midwives or our nurses that it's basically like you had a vaginal C-section. A lot of us who had the 4th degree tear, we've been given an episiotomy, and maybe your baby has been pulled out of you with either a vacuum or forceps. If you think about that in relation to a C-section, you're being cut and your baby is being pulled out of you, and you have significant amount of damage, muscle damage, fascia damage. It's going to take a long time to heal. You're at a really high risk of infection because of where your tear is, having all of your postpartum bleeding, all of your postpartum lochia come through there with your tears, so you're at a higher risk of infection. You're also at a higher risk of postpartum hemorrhage.
Laura mentioned that wound care might include a sitz bath, peri-bottle numbing or antiseptic spray, keeping the stitches clean, padding instead of wiping, and more.
Not only are you having to do all of that wound care, you're in a lot of pain. Pain with sitting, pain with bowel movements. I have listed there pain with sex, but that's not even on the radar in the, immediate postpartum experience. One of the other problems with pain is that women are given for the pain relief opioids or Percocets or Vicodin. As a side effect of them is constipation. And whenever you're having stitches in your rectum, constipation is the last thing that you want. You're usually taking a lot of stool softeners, and so you have this dilemma of, do I take the pain medication and possibly have the side effects of constipation, or do I just deal with the pain? And some of it we've already talked about with the initial fecal incontinence, gas incontinence. Those are things that are very common. I created a poll in our support group that asks specifically how many people have dealt with either fecal incontinence or gas incontinence, because a lot of the research that is already out there combines 4th degree tears and 3rd degree tears. And I wanted to look at just us specifically. What are they experiencing? And in our support group, 70% of us said that they have dealt with fecal incontinence. And that was defined as enough leakage to actually soil your underwear. Even if you don't have that soilage, you also are dealing with a lot of urgency. So you have to go to the restroom, you have to go right away, and you do not have a long time to make it. Anytime you're trying to get out of the house, you have to get to the restroom right away. That can become a big problem. So unfortunately, a lot of women become isolated, don't leave their house a lot. They're either, too scared or too embarrassed to have to deal with something like that. Whenever you have a newborn baby and then you're also having to deal with a lot of physical complications yourself, it just makes it really hard. Another thing, like I mentioned, was gas incontinence. Based on a poll in our support group, 90% of us have dealt with that. And I don't have the number off the top of my head, but a significant amount of those, it lasted at least a year. Another thing that you deal with is just trouble getting clean after a bowel movement. So not only are you possibly experiencing some incontinence, once you finally do get clean, maybe the next time you go to the restroom, you just pass urine when you wipe maybe some stool on the toilet paper. Another thing that can impact us physically is potential for prolapse. Anyone who has a vaginal delivery, that is a risk, especially with the rectal prolapse. Another thing that I mentioned before was the fistula, those tunnels between the vagina and the rectum. So that is how it impacts our lives physically. So how about emotionally? If you can imagine some of the things that I've already mentioned, some of the complications, it's just a lot of embarrassment and shame, isolation. You feel like you're the only one going through it. It's not something that you really feel comfortable talking about with other people. Maybe you had a vacuum or a forceps delivery. Maybe you had an episiotomy. Maybe the baby was in distress and needed to come out right away. And so those traumatic events that have to do with the delivery, you feel broken, you feel dirty, like I was mentioning. A lot of people don't talk about it, so you think you're the only one going through it. In reality, there are a lot of other people who are going through it too. Now that I am, a bit more comfortable talking about it and I'm posting things on social media, it's amazing how many people who I actually know in my real life who are going through this also. Marital and relational issues because of it. Part of it is the trauma. You don't talk about it with anyone, including your spouse or, your partner. And so that can obviously put a strain in the relationship. But as far as emotional issues, that would be another one, is the strain that it puts on your relationship. This is another one that varies a lot depending on the person. A lot of us get cleared at 6 weeks. Are we actually physically ready for sex? Absolutely not. Most people do wait longer. Based on a poll in our support group, the average time that someone waits to have sex is between the 3 to 6 months range. A third of us wait at least 6 months before even attempting to have sex for the first time. So that is not something that you need to be rushed into just because you maybe get the all clear at your 6-week checkup. There is a study that looked specifically at this that was comparing how painful sex is for someone depending on what degree of tearing they had. Someone who had a 2nd degree tear compared to someone who had no tearing at all. The 2nd degree tear would be 80% more likely to be painful with their sex compared to someone who did not tear at all. And someone who had a 3rd or 4th degree tear, they were put together in the same group. They are 270% more likely to have painful sex than someone who had no tearing at all. As far as like your 4th degree tear, tearing all the way through your rectum, my answer would be no, but can you cause some sort of like superficial tearing? Can you maybe have some granulation tissue, like tissues that aren't completely healed that can easily be opened up? Those could be irritated and aggravated, and it does happen. In my non-professional opinion, I would strongly advise against it. Even if you're healed, there can still be some damage left there in your anal sphincter muscles. And even if you're maybe having no problems, they do weaken with age, and we know that. That's why a lot of people have more incontinence as they get older. Would I risk potentially causing more damage to that? Personally, I would not. The first thing I would say to them is to not feel pressured to start back into anything that you are not ready for. I don't know if anyone feels completely 100% ready, both physically and mentally, once they do start, but it is definitely something that you do not want to feel pressured into and start before you are both physically and emotionally ready. If you do get to that point, and again, that can range anywhere from a couple of months postpartum to a year or two postpartum, it is completely subjective, and it's going to be when you are ready. But once you do feel like maybe you are ready to start, then my suggestion would be just do things by yourself first and check things out on your own so that you know exactly what's going on with your body, experiment a little bit, see if there are any tender spots. And again, once you do feel comfortable doing that with your partner and with someone else, take it really slow and do not jump straight into actual vaginal intercourse right away. There are plenty of other things that you can do physically. Intimacy is not just vaginal intercourse. And there's so many other things that you can do before you're ready for actual vaginal intercourse. There are a lot of people who say that having 1 to 2 drinks beforehand can help them just relax a little bit, because like we mentioned, it's such a mental thing. It's not just a physical thing. And so being mentally prepared and just mentally relaxed can help so much on the physical aspect. And then once you are ready for actual vaginal intercourse, a lot of lube. That is for everyone, even those who don't have significant tearing, especially if you're breastfeeding, because when you're breastfeeding, your estrogen levels are really low, and so you don't have a lot of your natural lubrication. Like I was mentioning before, you want to have a lot of foreplay beforehand. You want to make sure that you are completely physically ready, emotionally ready, and that really helps things to not be so painful. Also, trying different positions, and this varies a lot with everyone. Some people find some positions more comfortable or less painful, and then other people completely disagree. So it's something that you need to experiment with yourself and find out what is best for you. Some people, it's not as much the physical part of it, but the kind of emotional part of feeling completely in control, and so they want to be on top. So if you do continue to have a lot of pain, if it's something, that you have tried different positions, you've tried all of these different things that I've talked about, and it's still really painful, then I would definitely suggest seeing someone, talking to either your OB or your midwife, maybe referring to a specialist like a urogynecologist. But I would highly recommend for everyone, even before you try having sex, to see a pelvic floor therapist. They are extremely knowledgeable about helping you find out specifically what is going on in your case. Some people's, their pelvic floors are too tight. Some people's pelvic floors are too weak, and it's different for everyone. It's not kind of a one size fits all. What kind of things you need to do to help yourself. If you have had a 4th degree tear, then please feel free to join our support group on Facebook. If you did not have a 4th degree tear, if you had maybe a 3rd-degree tear, even 2nd-degree tear. I know there are all different levels and types of tears that still cause a lot of problems. There is another support group on Facebook. It's called Birth Tear Support. It includes all types of tearing. I did not start that group, but I'm in it, and it is a wonderful group as well.
At the end of the day, this is what a person's daily life could be like. It might be helpful to understand what your partner's going through after childbirth. To those watching who did experience this, it's helpful to just know that you're not alone and to have a space to talk about these things. I don't want anyone to face anything alone and to be ashamed about the struggles that they face every day. Know that you aren't alone. Thanks for watching. Subscribe if you'd like. I'll see you next time.